Hello everyone. In this video we are going to talk about MMT of hip flexors. In this mainly we have to study three muscles: psoas major, iliacus and sartorius. First of all, we will be discussing the origin and insertion of these muscles. Psoas major origin is from transverse process of L1 to L5. Insertion is in lesser trochanter of femur. Iliacus origin is from iliac fossa and iliac crest. Insertion is in lesser trochanter of femur. We will be studying MMT of these two muscles together. Sartorius origin is from anterior superior iliac spine. Insertion is in medial surface of shaft of tibia. Now to test the MMT of iliacus and psoas major, patient position should be short sitting with thigh fully supported on table and leg hanging over the edge. Position of the therapist should be standing next to the limb to be tested. Countward hand to be given resistance over the distal thigh just proximal to knee joint. Test. Patient flexes hip to the end range against the examiner's resistance, which is given in the downward direction towards the floor. Instructions to the patient: lift your leg off the table and don't let me push it down. Grade 3 means muscle is fair enough to work. Grade 4 means muscle is good enough to work. Grade 5 means muscle is normal. Grade 2 means muscle is very poor. Always start MMT with grade 3. If patient is able to perform grade 3, then go for grade 4 and 5. If patient is not able to perform grade 3, then go for grade 2 and 1. Grade 3, patient completes test range and hold the position without resistance. Grade 4, patient is able to perform the action against the moderate amount of resistance. Grade 5, patient is able to perform the action against the maximum amount of resistance. Grade 2, position of the patient: side lying with the limb to be tested uppermost and supported by examiner. Trunk is in neutral alignment. Lowermost limb may be flexed for stability. Position of therapist: standing behind the patient. Cradle test limb in one arm with hand supported under the knee. Opposite hand maintain the trunk alignment at hip. Test: patient flexes the supported hip. Knee is permitted to flex to prevent the hamstring tension. Instructions to patient: bring your knee up towards your chest. Grade 2, patient complete the range of motion in side-lying position, which is in gravity eliminated position. Grade 1 and 0, position of the patient is in supine. Test limb is supported by the examiner under calf with hand behind the knee. Position of the therapist: standing at the side of the limb to be tested. Test limb is supported under the calf with the hand behind the knee. Free hand palpate the muscle just distal to the inguinal ligament on the medial side of the sartorius. Test: patient attempts to flex the hip. Instruction to the patient: try to bring your knee up to your nose. Grade 1, palpable contraction but no visible movement. Grade 0, no palpable contraction of muscle. Now to test the MMT of sartorius. Position of the patient: short sitting with thigh supported on the table and leg hanging over the side. Arms may be used for the support. Position of the therapist: standing lateral to the leg to be tested. Place one hand on the lateral side of the knee. The other hand grasps the medial anterior surface of the distal leg. Hand at knee resist hip flexion and abduction. Hand at the ankle resist hip external rotation and knee flexion in grade 4 and 5. No resistance for grade 3. Test: patient flexes, abducts and externally rotate the hip and flexes the knee. Instructions to patient: therapist may demonstrate the required motion passively and then ask the patient to repeat the motion. Also ask the patient to slide your heel up the shin of your other leg. Grading: always start with grade 3. Complete movement and hold end position but take no resistance. If patient is able to perform grade 3, then go for grade 4. Patient is able to perform the end range with moderate amount of resistance. In grade 5, patient is able to perform the movement against maximum amount of resistance. Grade 2, position of patient: supine. Heel of limb to be tested is placed on contralateral shin. Position of therapist: standing at side of the limb to be tested. Support limb as necessary to maintain alignment. Test: Patient slides test heel upward along the shin to the knee. Instruction to patient: slide your heel up to your knee. Grade 2. Complete desired movement in gravity eliminated position. In grade 1 and 0, patient position is supine. Position of the therapist: standing on the side of the limb to be tested. Cradle test limb under calf with hand supporting limb behind the knee. Opposite hand palpate sartorius on the medial side of the thigh where the muscle crosses the femur. Examiner may prefer to palpate near the muscle origin just below the ASIS. Test: patient attempts to slide heel up shin towards the knee. Instruction to patient: try to slide your heel up to your knee. Grade 1. Therapist can detect slight contraction of muscle, no visible movement. Grade 0. No palpable contraction.